answer period. I recognize the Leader of the Opposition.
Mr. Speaker, Saskatchewan people continue to fall further and further behind under this tired and out-of-touch government. 57% of people struggling to pay the grocery bills. 6,000 jobs lost last month. Fewer head office jobs and fewer head offices here in Saskatchewan today than when that Premier took office. Mr. Speaker, Saskatchewan people need a break, but that Premier is failing to deliver. Why is the Premier refusing to deliver the cost of living relief that Saskatchewan families need, and why won't he cut the fuel tax to deliver that break that struggling families desperately need him to make?
Recognize the Premier.
Yet again, I would point the Leader of the Opposition one more time to pages 75 and 76 of the budget, Mr. Speaker, where in 3 out of 4 income categories, Regina, Saskatchewan is deemed the most affordable place in Canada to live. Mr. Speaker, it goes on here. Let's go to a few media articles. The CTV News on March the 1st of this year reported in the title, Mr. Speaker, as I quote, "Regina's affordable housing market is piquing the interest of buyers from across Canada," end quote. Mr. Speaker, just prior to that, in February 28, CTV also had this headline, Mr. Speaker, again I quote, "Regina ranked as the most affordable city in Canada to purchase a single-family home," Mr. Speaker, end quote. Mr. Speaker, we continue through the strength of a strong and prosperous economy to attract people to live in our communities, Mr. Speaker, which are wholly affordable relative to other places across Canada, and we can get into those comparisons, Mr. Speaker, and we continue to work to attract not only head offices, Mr. Speaker, but to attract industries to invest in this province, Mr. Speaker. What we see with the members opposite, Mr. Speaker, is again saying one thing, do another, as the NDP's head office is actually Jagmeet Singh's office in Ottawa, Mr. Speaker.
Recognize the Leader of the Opposition.
That's a look, Mr. Speaker, that from a Premier who's failing to deliver the cost of living relief that Saskatchewan families need, and he's also failing to deliver when it comes to health care that Saskatchewan families can count on.
Right.
Mr. Speaker, earlier today we were joined by Moose Jaw firefighters calling on this government to restore service to the Hyperbaric chamber. Firefighters raised almost $1 million to get the Hyperbaric chamber built in the first place, but now it's serving only one patient while all others have to go out of province for the care they need. What does the Premier say to firefighters who have worked so hard to get this facility built, only to see Saskatchewan patients turned away?
You're here.
Recognize the Premier.
First and foremost, I would say thank you to those firefighters in Moose Jaw for not only the job they do each and every day running towards danger, Mr. Speaker, while we, the rest of us quite often will find ourselves running a different direction. Mr. Speaker, thank you to them. Thank you, and I remember the discussions around the construction of the Wigmore Hospital in Moose Jaw, the discussions that we had, previous Minister of Health, Mr. Speaker, with the firefighters from Moose Jaw on their fundraising campaign to ensure that the Wigmore Hospital, a new Wigmore Hospital, Mr. Speaker, did include a hyperbaric chamber, Mr. Speaker. That commitment was made by this government at that point in time, Mr. Speaker, and that commitment to operate that hyperbaric chamber remains true today, Mr. Speaker. And it's my understanding, and this has not been mentioned by the members opposite, that there is a requirement for 4 respiratory therapists to service the full scope of hours that hyperbaric chamber would like to offer. 3 of those respiratory therapists have been secured, Mr. Speaker, which is resulting in a reduced service, but a service that is being provided to the, which I think was delivered in committee the other day, 2 individuals that are utilizing the chamber or need to utilize the chamber in the near future, Mr. Speaker. Upon the successful recruitment of a 4th respiratory therapist, Mr. Speaker, full services will resume.
Recognize the Leader of the Opposition.
Mr. Speaker, I can assure the Premier that the people of Moose Jaw and the Moose Jaw firefighters remember that story just a little bit different than the one that the Premier just told.
Right.
But the Moose Jaw firefighters are not the only ones who are frustrated by this government's failures with the hyperbaric chamber. Braden Duchek joins us here today in the West Gallery.
You're here.
Braden's mum is a cancer survivor who relies on the hyperbaric chamber for the care that she needs. And he has been a tireless and effective advocate for his mum and she's now able to access that chamber. And, Mr. Speaker, that is a good thing. But because of the chronic short staffing, she's the only person in the province who is able to do so. And Braden wants this chamber to be available to everyone who needs it to have access to this life-saving care.
That's right.
What does the Premier have to say to Braden?
Here.
Recognize the Premier.
First of all, I welcome Braden to his Legislative Assembly and thank him for his advocacy on behalf of healthcare services not only being offered to the community of Moose Jaw, but I think the only hyperbaric chamber in Saskatchewan, healthcare services that are made available to all Saskatchewan residents. It's my understanding that the Minister of Rural and Remote Health, who also serves as an MLA for the community of Moose Jaw, has been in contact with Braden, Mr. Speaker, and I would say this to Braden, he is right. These services, we didn't invest in the hyperbaric chamber with within the new Wigmore Hospital with the intent of not operating it to its full capacity, Mr. Speaker.
Exactly.
Mr. Speaker, there has been some challenges, some human resource challenges. Not only, and I would say those challenges are not only exclusive to the province of Saskatchewan, but those are across Canada, Mr. Speaker. And what you have seen is one of the most ambitious health human resource action plans put in place in this province that is ensuring, Mr. Speaker, that today we are able to offer 3 of the respiratory therapists offering that service in the community of Moose Jaw with every intent to secure, Mr. Speaker, a 4th respiratory therapist and make that service available as it was intended to be, Mr. Speaker, when we made the commitment to build the facility.
Recognize the Leader of the Opposition.
Mr. Speaker, sadly, this is what Saskatchewan people have come to expect from this tired and out-of-touch government. They lurch from crisis to crisis, but consistently fail to get to the root cause of the problem in the first place. Mr. Speaker, with the hyperbaric chamber, as with so many other issues in healthcare, the root cause is short staffing. We need to hire more healthcare workers, and we need to end the culture of burnout and disrespect that drives healthcare staff from the profession and the province in the first place. We need a grow-your-own solution to plan to retain and train Saskatchewan healthcare workers to give care to Saskatchewan people. When will the Premier recognize that the healthcare staffing plan is not working and start listening to the solutions that are coming from healthcare workers in this province?
Recognize the Premier.
Mr. Speaker, I was drawing quite the comparison in my mind. I was elected to this Assembly on behalf of the people of Roster and Shelburne in 2011, Mr. Speaker. Prior to that, I worked within my community as a healthcare advocate, recruiting physicians at that point in time, of which our province had become desperately low on, Mr. Speaker. I remember the conversations I had then, newly elected, Mr. Speaker, with the then Minister of Health, the member from Indian Head, Milestone, today, Mr. Speaker, our Minister of Government Relations, and the revamp of the College of Medicine at the University in the University of Saskatchewan in Saskatoon, the expansion from 60 physician training seats to 100, the expansion of the residency positions, Mr. Speaker, from 60 to 120. We've seen since that, Mr. Speaker, the doubling of nurse training seats in our institutions, the addition of psychiatric nurse training seats, of which the members opposite actually got rid of here in the province, Mr. Speaker, and now you're seeing the significant expansion of nurse practitioner training seats, Mr. Speaker, the expansion of scope for them to operate within our communities, Mr. Speaker. We are not about to take any lessons, Mr. Speaker, when it comes to health human resource action plans from the members opposite, because their action plan was to fire nurses, to fire physicians, Mr. Speaker, and send our kids to Alberta because they closed their hospital.
Recognize the member from Regina Walsh Acres.
I'll just remind the Premier, 53 hospital closures under his watch as Premier. That's the fact. You know, it's a good thing that Braden's mom is able to get the care at the hyperbaric chamber. But it's a crying shame that nobody else in Saskatchewan can because of the short staffing crisis that this government has created. Healthcare workers are not being heard by this tired and out-of-touch government, and it's long past time that the Sask Party take responsibility for the damage that they have done. Will the minister do that today? It's been 3 years, Mr. Speaker. When will the hyperbaric chamber in Moose Jaw be fully operational for all of Saskatchewan people?
Recognize the Minister of Rural and Remote Health.
Thank you, Mr. Speaker. As the Premier said in his previous answer, we are aware through the SHA that there are 2 patients in Saskatchewan seeking treatment at the Hyperbaric Chamber. One is currently receiving that treatment, and the other, to our understanding, Mr. Speaker, is meeting with their physician to build a treatment plan to receive treatment at the Hyperbaric Chamber. Mr. Speaker, as the Premier said, we require a 4th respiratory therapist. That position is being recruited as we speak, Mr. Speaker, and once recruited, we're anxious and excited to see that the services at the Moose Jaw Hyperbaric Chamber fully resume. Thank you, Mr. Speaker.
Recognize the member from Regina Walsh Acres.
Mr. Speaker, the government has said that the Hyperbaric Chamber is closed. No physicians know it's closed, so why would they refer patients to the closed Hyperbaric Chambers? Patients are going out of province to get this care right now. Their plan isn't working. If it was, the firefighters wouldn't have joined us today to say that more needs to be done. If it was working, Braden wouldn't be here saying that more needs to be done. Chronic short staffing and burnout is driving healthcare workers out of our province, and it's forcing patients out of our province too. Does the minister think it's acceptable for the Hyperbaric Chamber to be providing care to only 1 patient, while some in Saskatchewan go to Alberta and the rest go without care?
Recognize the Minister of Rural and Remote Health.
Mr. Speaker, I would ask the member, who are the rest? We are aware of 2 patients that are seeking treatment from the Hyperbaric Chamber. One is currently receiving those treatments, and I thank Braden for joining us here today. He has been a tireless advocate for services for his mother, and as the Premier indicated, I was happy to have correspondence together with Braden about the situation. Mr. Speaker, we are seeking a 4th respiratory therapist, and as soon as that individual is recruited, we will gladly see the services of the Moose Jaw Hyperbaric Chamber fully resumed. Thank you.
Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. Saskatchewan people expect the care that they need to be there when and where they need it. But this tired and out-of-touch government has broken our healthcare system, and they're not the ones up to fix it. They've had 6 years under this Premier to do it, and they have failed. It's time for a change, Mr. Speaker. Does the Minister of Health take any responsibility for the mess the Sask Party has made to our healthcare system?
Recognize the Minister of Rural and Remote Health.
Thank you, Mr. Speaker. Our government's Health Human Resources Action Plan is one of the most ambitious plans in the country, if not the most ambitious, Mr. Speaker. If the members opposite spent a little bit more time listening and a little bit spent less time talking, they would have heard all of the positive results that we are seeing from the Health Human Resources Action Plan, Mr. Speaker. Just last week, we announced 232 new and enhanced full-time positions have been filled in the rural and remote areas, Mr. Speaker. More than 300 physicians are now working through our SIPA program, Mr. Speaker. 118 applications have been approved through the Rural Physician Incentive Program for up to $200,000, Mr. Speaker. We have 300 new full-time CCAs working in this province, Mr. Speaker. This plan is working, and the results can be seen all across our province. Thank you, Mr. Speaker.
Recognize the member from Regina Elphinstone Centre.
Thank you, Mr. Speaker. I have serious doubts about how those answers are going to go over with the people of Moose Jaw in the upcoming election, but I guess we'll see, Mr. Speaker. Saskatchewan people wait longer than anywhere else in Canada for knee and hip replacements. It was that way before this government gave a major Sask Party donor a sweetheart deal to perform these procedures in Calgary, and it was that way after this government gave a major Sask Party donor a sweetheart deal to perform these procedures in Calgary. Worst in the nation, Mr. Speaker. So, I'd like the minister to walk us through his thought process. Why did this tired and out-of-touch government give a Calgary-based Sask Party donor a sole source contract valued at $6 million just so we could still be last in the nation? Why not put that money into building Saskatchewan hospitals, Saskatchewan healthcare workers, building capacity here at home? And did the former Finance Minister Kevin Doherty have anything to do with it?
Recognize the Minister of Health.
Thank you, Mr. Speaker. This government is committed to pursuing all options when it comes to improving access to joint replacement surgeries for patients in our province, Mr. Speaker. That includes some of these being done out of province, as we've talked about earlier, Mr. Speaker, in this chamber. But in addition to that, to further to the member's question, we are also making a significant investments, record investments into surgeries and surgical capacity here in this province. As I've said before, nearly $670 million into doing more surgeries here in our province, supporting our surgical teams and networks across Saskatchewan, Saskatoon, and Regina, and our regional centres that perform surgeries for people right across this province. We're going to continue to make sure that we look at doing everything we can to make sure that patients get the surgeries they need on a timely basis, Mr. Speaker.
Recognize a member from the John Elphin Stone Centre.
Mr. Speaker, the health minister can't keep his story straight, and we need only look to his words for proof. First, he said in here there was an RFP, a, quote, open and transparent process, a competition for this contract. From Hansard, he also said, and I quote, it's my understanding that Mr. Doherty did not lobby on this, was not involved in this particular RFP. Then he said out there it was a sole source contract, but don't worry, apparently SAS Bills and Procurement looked into other firms and the SAS party donor was the only option. Prove it. Will the health minister release the SAS Build and Procurement records, yes or no?
Recognize the Minister of Health.
Thank you, Mr. Speaker. To the member's question, and first of all, I will say this. I made a correction as soon as I could that day, that afternoon, 10 minutes after this, the proceedings in the chamber, Mr. Speaker, when talking to the media, and I made a further clarification the following day, Mr. Speaker. Now, I would say this. We have, as I mentioned last week, the Chief Procurement Officer for SAS Builds had been consulted on this particular initiative and was satisfied that this was the appropriate course of action to take, Mr. Speaker, because of the nature of it. Mr. Speaker, we were looking to do everything we could to address the wait list of those that are waiting for surgeries, known as the long waiters on the healthcare, the surgical waiting lists that have built up over the course of the pandemic, Mr. Speaker. Since that point in time, we've made significant progress in reducing those numbers, shortening the waiting list, shortening the waiting times. Still work to do, Mr. Speaker. We're committed to getting that done so people can get their surgeries on time, Mr. Speaker.
Hear, hear. Recognize a member from the John Elphin Stone Centre.
Mr. Speaker, this is why people are fed up. First, the minister said former SAS party MLA and former finance minister turned lobbyist Kevin Doherty was never in the picture. Then he admitted to meeting with Doherty, but about something else, but he can't remember about what. And later, when pressed by reporters for specifics, the minister said he's had so many meetings he just can't recall what they were about. He's had the weekend to look through his call and meeting logs to the minister. Since Kevin Doherty started lobbying him in May 2022, did he ever speak to him? Did he ever exchange emails with him? Did he ever meet with him about the surgical backlog, yes or no?
Hear, hear. Recognize the Minister of Health.
Thank you, Mr. Speaker. This member opposite, she has quite a track record, Mr. Speaker, of the things that she says in this House. Mr. Speaker, the character assassinations that she issues in this House, Mr. Speaker.
That's out of order, Minister. It's out of order. Go ahead, but just warning you.
Thank you, Mr. Speaker. The lobbyist registry is a list of registered lobbyists who have made an application to the registry to be able to lobby politicians, to be able to lobby MLAs on this side of the House, on that side of the House. Just because a lobbyist is listed on the registry does not necessarily mean, Mr. Speaker, that they have met with MLAs. Mr. Speaker, I could point to the member opposite her own record. For example, I think she has multiple entries there on the lobbyist registry of meeting with a tobacco company. Did she meet with them? I don't know, Mr. Speaker. So I would say this, Mr. Speaker, it's important to be clear about what the lobbyist registry is and what it isn't, Mr. Speaker.
Hear, hear. Recognize the member from the John Elphin Stone Centre.
Mr. Speaker, people don't want to see him pointing fingers. They want to make sure his hands are on the wheel. First, there was no RFP. Then there wasn't. First, there was no meeting. Then there were several meetings, but 100% definitely about something else other than this, but he can't recall what. But here's one thing the health minister was half right about. Mr. Speaker, on Thursday he said, quote, the Minister of Health does not sign contracts. The Minister of Health, we don't do that. Well, technically, that's correct, Mr. Speaker. It's the Premier who signed the order in Council authorizing the $6 million sweetheart deal. I have a copy right here. So is the Health Minister blaming the Premier for signing this dodgy donor deal with Doherty? Hear, hear.
You recognize the Health Minister.
Thank you, Mr. Speaker. Due to as I mentioned before, due to a slowdown in non-urgent procedures during the pandemic and non-essential healthcare services, certain procedures and healthcare services were slowed down. That includes surgeries, Mr. Speaker. At what point, Mr. Speaker, it actually reached about 36,000 people waiting for surgeries in the middle of the pandemic as a result of surgical slowdowns, Mr. Speaker. We continue to make a significant progress reducing that. The vast majority of these procedures being done in this province, but also utilizing other options to make sure that we can get long waiters who are waiting for whether it's hip surgeries or knee surgeries through this example here, through ClearPoint in Calgary, Mr. Speaker, giving them options to be able to get those surgeries done, Mr. Speaker. We now reduce that wait list significantly. We're going to continue to make those investments, Mr. Speaker, so that we can get these surgeries completed.
Yeah. Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, there's more questions than answers with this sole source contract, but there are still no answers when it comes to the Thrift Lodge Motel. On Thursday, the Sask Party ordered its response to my question on that issue. That means instead of exercising their option to answer it today, they're going to kick it down the road 6 months. What were those questions, you may ask, Mr. Speaker? Quote, to the Minister of Social Services, the amount of money the ministry paid out to the Thrift Lodge Motel in 2019, 2020, 2021, 2022, and 2023. It doesn't get any simpler than that. How does the Sask Party justify delaying the answer to these 6 numbers 6 months from now? Hear, hear.
Recognize the Minister of Social Services.
Mr. Speaker, we've been over this many times. Mr. Speaker, the member opposite asked for some information late last year. That was a lot of work was undertaken by the ministry to get that information. There was subsequent ask of more information, Mr. Speaker. That number and those numbers that were asked for by the member are coming very shortly, and that's something I've committed to, Mr. Speaker. In the meantime, Mr. Speaker, we've made some improvements or changes to our procurement policy, Mr. Speaker, in terms of getting quotes, and as well as an RFP process for a block of hotel rooms in Regina and Saskatoon, Mr. Speaker. I ask there's going to be an opportunity for even more questions this afternoon and estimates, Mr. Speaker. I look forward to that process.
Here. Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, unacceptable. There are nearly 2,000 people that work for that ministry. There are dozens of political staff for the Sask Party in this building alone. Surely it shouldn't take weeks and weeks and months for the Minister of Social Services to provide basic information about public dollars being paid out to hotels connected to Sask Party hotels. Plus, his colleague sits in this chamber. They literally share an office. He doesn't even have to pick up the phone. He can just walk down the hallway and ask him. These guys are so lost, Mr. Speaker. They're losing their starting lineup. They're limping from crisis to crisis, mess to mess, and this mess stinks. How much longer will people have to wait before the minister shines some sunlight on this waste of public dollars? Hear, hear.
Recognize the Minister of Social Services.
Mr. Speaker, the member won't have to wait very long at all, Mr. Speaker. In terms of smear volume 2, Mr. Speaker, totally ignored your admonition at the beginning of this sitting day, Mr. Speaker. In terms of thousands of public employees, Mr. Speaker, dedicated public employees in the public service, Mr. Speaker, is she suggesting in the Ministry of Social Services that we pull off from frontline child care protection, Mr. Speaker? Is that what she's talking about today?
Listen up.
She's asking me to use the public service, frontline caseworkers, child protection workers, bring them all into Regina to get the information for a public smear campaign, a political vendetta by that member, Mr. Speaker. That is the worst idea I've ever heard. I've heard a lot of bad ones from the NDP.
There's a lot of bad.
That's right at the top.
I recognize the member from Saskatoon, Newawson.
Thank you very much, Mr. Speaker. In the first 3 months of 2024, 113 people died of suspected overdose. It's a shocking number. It's one a day, more than one a day, Mr. Speaker. One mother, one father, a sister, a brother dying every single day this year. Mr. Speaker, we need more than talking points and blame casting to fix this crisis. We need solutions. We need to get people into treatment, and we need to keep people alive long enough to get there.
That's right.
Mr. Speaker, when will we see an evidence-based plan from that minister to stop the record-setting overdose deaths in our province?
Hear, hear.
Recognize the Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. You know, on this side of the House, Mr. Speaker, we agree that action needs to be taken to address mental health and addictions, and that's why we introduced an action plan on mental health and addictions in October of 2023, Mr. Speaker. Since that time, we have made announcements that directly impact individuals who are battling addiction, Mr. Speaker. We have introduced a provincial drug alert system. We have overdose outreach teams. We have a free naloxone take-home kit program that has trained more than 40,000 individuals to administer naloxone, and with that program, Mr. Speaker, 10,000 overdoses have been reversed. That's 10,000 lives saved in Saskatchewan, Mr. Speaker. The member opposite speaks about treatment. Absolutely. We need individuals to reach treatment, and that's why we are more than doubling the number of treatment spaces that we are offering this province. We are making it easier for individuals to access those treatment spaces, Mr. Speaker, and when they are there, Mr. Speaker, we are wrapping supports around them through recovery-oriented systems of care so that we can save lives, heal families, and build stronger communities. Thank you, Mr. Speaker.